Thank you for joining us today. We're going to talk about light therapy and how we've incorporated it into the practice and the science behind it and what it does and how we've seen it work for our patients over the past year that we have brought it in. We're also going to specifically discuss using it as a therapy, so not necessarily surgically speaking in this webinar, but more as a therapy, and that is called Oralase, Smilelase, Babylase, L.A.F.T.R. They're kind of all the same thing and not at the same time. Okay, so welcome. Here's our agenda. We're gonna talk a little bit who, what, where, when, why. We're gonna do some laser basics. It does get pretty heavy in like the high school physics/science arena, but I promise that it's all going to come together and make sense. So just kind of reach back into that past. We'll talk a little bit about the science of fascia, and there's a little bit of overlap with the seminar, the webinar that we did on sleep disturbed breathing. So if you haven't heard that, if you don't have the link for it, Denise can always get that to you. We'll have contact information at the end. I'm going to move through that a little bit quickly because that's not the focus of what we're talking about, but it does play into all of this. And then we're going to talk about the therapies. So let's get started. So this is Denise. She is our hygienist. My name is Dr. Melissa Lopez. I'm a pediatric dentist here at Shadelands. And when I recognized that airway was something that was important for us to monitor for our patients, and that it didn't feel right to see patients from a very young age through 18 years old at least, and not screen for issues, let alone help direct parents in terms of what are the next steps to address some of these issues. We really found our why in terms of figuring out that we were in a unique position to be able to see kids. We're in their mouths already. We can ask these questions. And so our why is to identify potential issues early enough so that our patients can keep growing healthy smiles and minds for healthy breathing and sleep into adulthood. Like I said, this is Denise Meza. She's our hygienist here at the office, and she's helping us organize the airway program in the practice. And Denise gets a lot of questions from parents. And so here's some common questions. And these are, she compiled basically what we've heard through the past couple of years as we started talking about airway and specifically lasers and the therapies that we can use them. And so if you've had any of these questions, you're not alone. Lots of people have them, and we'll try to address as many as we can. So if you're just joining us, I did say it's a little bit hard to get all this information to 30 minutes. I was closer to 50 earlier today, so I will try to talk quickly. But please ask questions if you have any, and Denise is going to monitor the chat. So laser basics, a little brief dental history. I'm not going to touch on medical lasers. There's overlap, and the laser that we chose to bring into the practice is definitely used for lots of other procedures and other different types of specialty offices. But focusing on dental lasers and, well, lasers in dentistry started with Albert Einstein in the early 1900s theorizing about quantum theory. And we'll talk about that a little bit more in futures and further slides. Basically looking at how energy is transferred, okay, through the atom. Back in the 1950s, a maser was developed, and this came prior to the laser development, and you'll see the definitions of a maser and a laser here. We started to get experimentation in dentistry with lasers in the 1960s, and definitely there are people out there, not too many now, but definitely people who were early adopters of this technology and have had years of experience. With pediatric dentistry, it is a quote unquote newer specialty in that it didn't get incorporated until the late 1900s. So there are some pediatric dentists who have been using lasers, and think the one that I know who's been using it the longest has been since like the 1990s. And that's when the neodymium YAG and the erbium YAG lasers were introduced. And those are the ones that when I was looking at which laser to bring into the office and looking at the properties of lasers and what it meant for our patients, I chose to go with a photona laser, which is a dual wavelength. So it has both of these on the same machine, and we'll go through that. And in the 2000s, diodes were developed. So what does LASER stand for? It stands for light amplification by stimulated emission of radiation. And I love James Bond. Here's Goldfinger.
Considerably more practical. You are looking at an industrial laser which emits an extraordinary light not to be found in nature. It can project a spot on the moon.
Look how big this laser was back in the day.
Solid metal. I will show you.
Bond is laying on a gold table, so he's going to go ahead and start using it. Threaten to kill him. Famous quote coming up. I'm not sure we'll make it to the quote, but there you go. You see the pulsing. That was the flash up, and there's the laser. And you'll see that it's cutting through metal.
All my life, I've been in love with its color, its brilliance, its divine heaviness.
And we'll talk about that a little bit more. Okay. Oops. Okay. So going back, like I said, back to high school physics, there's a little bit, some definitions here. What is energy? Energy is the ability to perform work. Work is the transfer of energy. We know that quantum theory, energy cannot be created or destroyed, only transferred. Power equals the energy used over time or the rate of doing work, and it's measured in watts. And light is an electromagnetic energy. So light can do work in the tissue. And we currently use this in dentistry when we use curing lights to cure our dental materials. And, you know, nail salons use lights as well for curing now. Laser physics, the laser light is made up of photons. So these photons are little particles of energy that travel in a wave. So it is dual nature. That's a particle and it's a wave. So little particle swimming in a wave. It's non-ionizing radiation because it's in the infrared spectrum, and we'll see that a little bit later on. Monochromatic, unidirectional, and collimated, which means it's not going all over the place, kind of like you would get light coming out of a light bulb. It's going in one direction so that we can focus it. It's coherent and travels in unison. So again, if it were going all over the place, it could amplify itself, it could cancel itself out. Lasers are built so that that doesn't happen, okay? And it is emitted from a stimulated medium. So we've got solids, gases, and liquids. Here's the electromagnetic spectrum, and where we are is right here in the infrared spectrum. So here you see visible light to the left. To the left on the spectrum, you've got some of the ionizing radiation, and over here we've got the non-ionizing infrared radio waves. Because it's over on this side of the spectrum, it's actually safer than visible light. So some people have questions about that, but there it is. When we look a little bit closer, we've got near infrared and mid infrared, and these are the two that we'll be talking about today, the neodymium YAG and the erbium YAG. So ND YAG and erbium YAG, that's how we refer to them. They are invisible, so the light that the laser emits, that's a little green light that we can see while we're using it for our therapies, that's a visible light just so that we know where we're aiming at. And like I said, you get the emission through solid state. So what happens is you've got a flash lamp, shoots light through a solid state. So right here on the top, we've got the ND YAG crystals. Down here, we've got the erbium YAG crystals. This is a diode that's electrically stimulated, so it does produce some heat. And then right down here, we've got the CO2 laser. There's gas in this chamber, and the light goes through that, and that's how you get the photons. We do not use liquid diode lasers in dentistry at the moment. Okay, and let's keep going because it'll be easier to understand this in a second. Actually, I'm going to skip to here. So The way that you have this work is that you've got the light shining into the laser and into the crystals. And what that light does is it transfers energy into the atom. And think back again to high school physics, and you've got these electrons and they're kind of going all around. And when they get excited, they move up into an unstable state. And that's called absorption of the energy. Now, the atom doesn't want to stay in that unstable state. So as the electron moves back down into a more stable state, it emits the energy. So remember, you can't create it, you can't destroy it, it can only be transferred. So the energy jumps to a higher level, and then in reverse, it emits it. And that's where we end up getting the photons of the crystals. So either the ND-YAG photons or the erbium photons. Okay, let's go back a little bit. So here you see, we've got this laser tube, you've got the atoms here. So if this little arrow here is the light going through it, right? It comes in this way. There's a tiny mirror here for the erbium YAG, another mirror here, another mirror here, and then it bounces off a little mirror in the head of this handpiece. And that allows us to focus the beam where we need to use it. There are hollow waveguides that are semi-rigid tubes, and the optical fiber, which is a quartz silica flexible fiber, because it is glass, it does break, and I did actually break mine, which everybody was very happy. I was the one that did it because the little tear fell. We saved a tiny little piece of it, and we were able to use it until we ordered another one, but they're quite pricey, so we treat them very gently. This is the ND-YAG, and again, light coming through, and then it travels through this fiber and out the handpiece. Here are some physics terminologies. I'm not going to go through each one of them. I am going to focus right here on this hertz and this pulse duration. Hertz and pulse duration. So hertz are the pulses per second. So that is the rate at which the pulse comes out of the laser, repetition rate. And if it's going very quickly, it allows us to cut a little bit more smoothly using the laser. Now, if someone is having some sensitivity to that, because a lot of times you can do what we need to do without using any anesthetic, we can lower the hertz, and that will lower how much it quote unquote hurts. Okay. And we'll talk about that in a minute because it directly relates to the pulse duration, which is the amount of time that the laser is on during each pulse. And this is all measured in microseconds. Additionally, let me see, where's my chapstick? So I used this earlier today, the focal point and the divergence. So when you're holding it and the light is coming out of the laser, depending on how close we've got it to the tissue, depends on how much power we're actually getting out of it and how much energy is getting absorbed to the tissues. So if I pull it away, I get a larger focal point, and we get what's called divergence. Okay, we went through this already. And so here are the different types of lasers. We've got continuous, gated wave mode, and free running pulse mode. So continuous lasers, like if you had a candle, you've got your finger and you just leave it on there. Of course, that's going to hurt, right? You're not moving your finger's absorbing all of the heat. Ouch, it's going to hurt. Gated wave is laser coming through, and there's like a little gate kind of going up and down, and that is what's creating the little spaces in between the pulses. So kind of like if you were moving your finger back and forth, you don't have to move it very quickly, but just because you've got a little time in between going over the flame doesn't hurt as much. Free running pulse mode, which is what the photonal light walker that we use is pulsing the actual light. Okay, so there's no gate, but it's pulsing. And because they figured out how to get this to pulse and how to control that, we've got a lot of control over the types of laser light that come out. So we can control the pulse duration and we can control the pulse design. Okay, and that's as if you had your finger and you were moving it very quickly over the fire, so you're not really feeling it. Okay. All right. And what you get there is called thermal relaxation, right? So if you're sitting there with your finger on top, no thermal relaxation. You don't give your tissues time to dissipate the heat between the laser pulses. If it's gated, you get a little bit of thermal relaxation because there's a little bit of time where you're not getting exposed to the heat. So it takes a little while for the tissues to heat up. And if it's pulsed, then you can control that a lot more, okay? And what this does is it allows us to cut hard and soft tissue as atraumatically as possible, because heat will damage tissue. And when you get damage to tissue, you get inflammation. And if you have an inflammatory response, there's can be pain, and there can be not as predictable of healing as you could get if you were using something that didn't produce as much heat. It also reduces the need for local anesthesia. So here's what I was talking about in terms of pulse design and duration. So depending on what we want to do, we get to pick how we're going to use the laser and what pulses we're going to use. Are we going to go very long and get less thermal relaxation? Or are we going to go very fast and get little chunks, so we're getting more thermal relaxation? And each tissue in the body has what's called an ablation threshold, because what this laser is doing, especially the erbium YAG, is ablating. And ablating is not vaporizing. Okay, I know it's fun to think of, like, a little Martian, like shooting a laser and poof, everything disappearing. Kind of happens like that, but not really. And we'll talk about that a little bit later. But the surgical and restorative efficiency is dependent on the tissue ablation volume. Okay. And with the Photona, what we can do is we can work in 50 to 1,000 microseconds. And with the ND YAG, we have 100 to 650 microseconds. Now, 1 microsecond, if we were talking just time and I said 1/1000, the next microsecond would be 11 days later. So that is how much time, that's how tiny that is, okay? And it gives a lot of control. And here is where we get the design, okay? If you look right here at this purple line, you can see how long this is. This gives you lower peak power, gives you more pulse time, you get less tissue penetration, and you get more thermal relaxation, more thermal, and it's less relaxation time. And this we use for soft tissue. Now, when we want to work with hard tissue like tooth enamel, we want a higher peak power. We want more tissue penetration. It's less thermal, and you get more relaxation time. Okay. And again, finger going over, sitting, moving like this, or moving very quickly. Okay. And the beautiful thing about the Photona laser is that it allows us to do all this with technology that they called adaptive structure pulse, which means that we can leave the watts, the hertz, and the millijoules the same and control the laser by controlling, again, the pulse design and the duration, which is quite novel. Okay, so the laser tissue interaction. How do lasers actually work? In order for a laser to get absorbed by the tissue, they need to be absorbed by something called a chromophore, which is a molecule that absorbs that particular wavelength. So as a laser is going through the tissue, if it doesn't meet with the chromophore, it passes through. And there are different ways that a laser can behave. It can get reflected, it can get absorbed, it can be transmitted, or it can scatter, okay? In the second schematic here, we've got the laser, we see some absorption, we've got the transmission and reflection. And I like this last one because it kind of puts it into human tissue, right? You see that there's skin, there's epidermis, and down here you can see the blood vessels, and you can see how, depending on where we want to aim and what our goal is, we get to pick what type of laser we're using, and also specifically the type of pulse, the duration, and so on and so forth. Okay, so with the ND YAG, the chromophore for ND YAG is pigmented chemicals, so hemoglobin and melanin. Okay, a lot of soft tissue there. For the erbium YAG, the chromophore is water. Okay, in water, we've got the hard tissue, the enamel, there's water in the hydroxyapatite of the enamel. And so that's what we're going to take advantage of when we use the erbium YAG for dental procedures. Okay, we've got laser absorption and tissue penetration here, and here's the absorption coefficient. So you'll see here's water, and ND YAG does not get absorbed by water very well, but you'll see that with an erbium YAG, we've got great water absorption. Okay, so we're going to take advantage of that. And that's not only going to allow us to use it for restorative dentistry, it's also going to give us the property that we can sterilize immensely well. Root canals, lesions, herpes, trauma, so on and so forth. And we'll get to that a little bit later. Here you've got other chromophores, and you can see these are the dental chromophores: water, hydroxyapatite, melanin, oxyhemoglobin. And in water, again, ND-YAG can penetrate very deeply because it's not absorbed by the water. Erbium-YAG gets absorbed, doesn't penetrate as deeply. And that's called the chromophore absorption coefficient. This is showing something similar. Again, you'll see that the ND-YAG is going deeper than any of the other lasers. And this is going to become important when we start to talk about something called photobiomodulation, because photobiomodulation has been around for a while, but it's been around in these wavelengths here, okay? The 600 to 900 nanometers, okay? So that it can get pretty deep, but with the ND-YAG, we can get deeper, okay? That is going to be very important when we start talking about the therapies and why we're using Oralase and photobiomodulation, okay? With the Erbium-YAG, you see, not quite as deep, okay? Very water, absorbed by water. So treats tissues with high water content, and again, not vaporized. The CO2 lasers, I won't talk about them much because we do not use that. It still does produce a little bit of heat. It does actually vaporize. And what happens is that when it gets absorbed by the water, because again, you can see here, chromophore for CO2 is also water. It gets a little bit deeper penetration. It does create some heat, and that's when you get that vaporization, okay? And in doing so, when you're using this for hard tissue, it glazes the enamel. So because it creates like a smooth surface, and that's not as ideal as getting a pebbled surface like we would by using an Erbium-YAG. And here are the photobiological effects. They're photothermal, photoacoustic, or photodisruptive, and these are the ones that we use for surgical purposes: fluorescence, photochemical, and then the photobiomodulation or biostimulation that we'll talk about a little later. All right, so what is the photothermal effect? The photothermal effect is that when it's absorbed by the tissue converts that to heat energy. It gets hot, okay? And every tissue has a certain level at which it will tolerate the heat, okay? Now, when we're using near visible infrared wavelengths like the ND-YAG or even a diode, those are absorbed more by pigments. So the dental target tissues for photothermal effects are gingiva and mucosa. So when we're doing frenum releases, we can use an ND-YAG. There is water in that area, so we can also use the Erbium-YAG, and I'll show you why we choose to do that for healing purposes. The photoacoustic or photodisruptive effect, that's where the pulse energy is converted into thermomechanical or acoustic energy. So if you have this water and it's getting absorbed and the water is vibrating, and then you get another bubble of water vibrating and that bumps into each other, and then it becomes this photoacoustic effect. And so what happens is that instead of vaporizing, it explodes. And so little chunks come off, okay? So when we're working with enamel, what you're going to see is that the little chunks actually pop off, and it leaves us with that micropebbling. There's this really cool substrate that they're using for pools now, and I don't remember what it's called, but I think it's quite expensive, and it is pebbled like that. And that is what we get, and I'll show you that in just a second. So when we're saying that you ablate with an Erbium-YAG laser, you can look in the thesaurus, and this is what it says. This is not the case. It's a very specific definition when we're discussing ablation with lasers. Every laser is not the same. So if someone says they have a laser, it's not the same as saying, you know, you have CO2 laser, you have an ND-YAG laser, you have an Erbium-YAG laser. You really need to know which type of wavelength you're talking about to understand the mechanics of how it gets used. So this again is not vaporizing, blowing it off in bits. And you can see here, this little schematic shows how the light comes in, gets absorbed, and then little pieces poof out. Okay, here's the histology of that. You can see these little pieces kind of coming out. Again, another little schematic, and this is an an SEM of the enamel, what it looks like afterwards. Okay, so super cool. And so how does this benefit us when we're making our decision as to what we want to do and what we're going to use the laser for? We want to take into account that the tissue temperature. Okay. If you have large relaxation periods, you don't get that thermal effect, you don't have as much of an inflammatory response. And if you don't have an inflammatory response, you don't have pain. Okay, so inflammation leads to pain. More inflammation, more possibility for pain. All right, and if you look here, what we're seeing is we're seeing light energy coming in. This is the tissue surface here. And as you break through that tissue surface, the body's going to send blood to start the healing process, right? To coagulate. So this an area of coagulation. Below that, you're going to get an area of edema or swelling or inflammation. Okay, and when we use the different types of lasers with a diode laser here, you can see the edema right under here, that little band of like reddish pink. This is a CO2 laser. You can see that it's a little less, but it's still there. Okay, and here's where you get that smoothing off of the tissue. And here's the ND-YAG. Now the ND-YAG, it also does produce heat. Remember, it's a thermal, thermal interaction. So there is some heat, but look at this. With the erbium-YAG, same histology as previously. There are the little bits flying off. And do you see that there's not very much edema here? So when we do releases with the erbium-YAG laser, the healing is different. And the healing is different because we're not initiating as much of an inflammatory response as we would by using either other lasers or even a scalpel. A scalpel will tear the tissue and it'll cause damage zone. Okay. You've got a laser here. If it causes heat, you're going to get that area of edema. You're going to get that inflammatory response. And if that happens, you're not going to have a predictable edge in your healing. All right. So the healing edge is not predictable if you have an inflammatory response. It's sort of reciprocal. Okay. More inflammatory response, less predictability. So if you have no inflammatory response, then the tissue stays where it is. Now, absolutely no response, absolutely no inflammatory response may not be possible, but decreasing that allows us to be much more conservative with the way that we do the releases and we do the surgeries. And it also allows for faster healing with less pain. Okay, so the erbium-YAG laser is the device with the least tissue damage and with good incision regularity, which is why we bought it. Okay, so now moving on, we're going to talk about photobiomodulation. Photobiomodulation uses low-level therapeutic setting of visible to near infrared light energy that stimulates the cells to naturally heal, to relieve pain, and to reduce inflammation. And this has been used, like I said, for many years in physical therapy and in lots of other different disciplines to help with healing, sports medicine, so on and so forth. And there are three key mechanisms that there are three key mechanisms of action for PBM. First one is that in absorbing the light energy, the mitochondria produce more ATP, which is like the energy for the cell. It produces reactive oxidants, which leads to gene transcription, cellular repair, and healing. And it also helps to dilate the blood vessels, improving blood circulation through the action of nitric oxide. Stumbling over my words. Drink water. So photobiomodulation is low-level light therapy. Okay, non-thermal, non-ablative laser energy at the cellular level. All right. What we see is fibroblast proliferation, increased collagen synthesis, and enhanced leukocyte phagocytosis. These result in more postoperative comfort, minimal edema, and more rapid healing than traditional techniques. So we use it in dentistry to treat oral ulcerations, inflammatory conditions. It can be used to address TMD pain, paresthesia, et cetera, et cetera. And I added these little blow my mind emojis because when I was talking about this earlier today, this is like almost like to the point of cutting edge where I'm a little bit like, wow, what's going on here? But some of the research is showing that there's something called human biophotons. And the biophotons are light particles that are generated within the body and radiate from the body's surface. And when they radiate from the body's surface, they're measurable. Okay. They're spontaneous emissions, and they're thought to be associated with the generation of free radicals due to energy metabolic processes. So any entity that has an energy metabolic process would emit these biophotons. And so it seems that it would be common to most living systems. And what that means is that we've got cells that could potentially be communicating through laser-like coherent webs of light between each other. Okay, so cells speaking through light, which is mind-blowing. And the fact that we can reach those areas with the laser light, it like takes it to another level of mind blowing. Okay, here are more science about how that works. And this is readily available. Again, these reactive oxygen species, the ATP, the nitric oxide, all of this has been known for quite a while. And it's kind of like a reminder to the cells to do their job. It's kind of like turning them back on. Okay, giving them the energy to start doing what they need to do. All right, it also helps to inhibit the A delta and the C pain fibers. Okay, and the C pain fibers also kind of come in when we start talking about the neuroscience and where those are going and how they play into trauma responses, and especially with the fascia and with the tightening of the fascia that can lead to a lot of other stuff. And we'll address that in a few slides. Okay, it can also help with lymphatic flow stimulation. Again, it helps to reduce the edema by getting more blood in there, helping with the circulation. You can address myofascial trigger points and acupuncture points by using the photobiomodulation. Here's some instances of why we would use it in a dental practice, and I think that we've used it on every situation. I just had someone come in with this trauma here that I, for some reason, blanked on using it, but we'll have her come back in. So here is a herpetic lesion. You can see when the vesicles are starting to pop up. If you treat it, they go away. And anecdotally, a lot of people have said that if you get it treated with a laser, a lot of times it does not come back in the same place. Here we've got canker sores, aphthous ulcers that we can help by giving them some light energy so they can heal faster. This is an example of colitis or an underlying Candida albicans infection. And what we traditionally have been telling people is to put some fungal cream on this at night so that it can help to heal the skin. But if we give it a little bit of light energy, we can help to also sterilize and get rid of anything that's kind of brewing in that moist environment. And I think I forgot to mention this a few slides back, but when I was talking about water being the chromophore for erbium YAG, when you have bacteria, and if you think of a bacteria being like a little sack of water, those are also absorbing the erbium YAG energy. So as it absorbs and ablates, you're sterilizing the field. So when you use it for dentistry, and especially when you've got a carious dental infection, you're not only making the preparation, you're also sterilizing the preparation. Okay. And then here is an example where a child fell, broke their tooth. The endodontist went ahead and treated the tooth, didn't feel like they had to go all the way down the canal, used photobiomodulation, and this is the tooth nice and healed. Okay. And also lymphedema. Lots of different reasons why we can use it. And I was at a symposium back in September where one of the practitioners was talking about using PBM on someone who had some neuralgia, and it had been, I think, 6 months since this set on, and typically after a few weeks to a few months, they say there's less chance of it, being able to resolve. And she was reporting that her patient had started to get some sensation back. Okay, so it's an amazing modality of therapy to be able to use. And we'll talk more about why that is in a minute. So for dentistry, how can we use lasers? We can use it for restorations, for caries management. In pediatric dentistry, lots of different ways that we can use it, from tongue tie releases to therapeutics to lesions, in oral diagnosis and medicine. We can use it for surgery. Periodontics, which is the gum and bone, a lot of times associated with bacteria. So because we get this nice disinfection going on, a lot of hygienists are now using it to help with perio pockets, to help with healing. And in endodontics, this one is kind of mind-blowing also. So I'm going to show a little bit of this in just a second. Okay, so here we've got the photoacoustic tissue interaction. It allows us to do minimally invasive preparations. This is a small little cavity, again, minimally invasive and sterilized. Okay, a lot of times you can do this with no anesthetic, and that is always nice, especially for kids, right? There's no heat, vibration, there's no noise of the handpiece that can, really set some kids off. You get increased bond strength because of the little pebble-like structure of the enamel that's left. Disinfection by the preparation because you're removing the smear layer. And because we can also use the ND YAG, we've got the soft tissue capabilities. Okay, so we can do soft tissue treatments at the same time. Now, here's the really cool photoacoustic stuff that is happening with endodontics or root canals. And in this little schematic here, you'll see how laser light comes in, agitates the water, forms a bubble, forms more bubbles. As the bubbles accumulate in the water, they start to bump into each other. As they bump into each other and they start to explode, starts to clean everything out. And when you've got a tooth and you've got tiny canals, traditional way of doing this is going in with a file, trying to clean it in, putting, different liquids to try to disinfect, and also to try to get the tissue out of there. And with the laser, all you have to do is use the photoacoustic streaming. Okay. And for the photona, this is called PIPs or sweeps. All right. So laser safety hazards. How am I doing on time? It's a medical class 4 laser. So you do have to have a license to operate it, have to be trained, and everyone's always got to wear goggles. So these are little tiny baby goggles. These are the goggles we use for kids. And then of course we've got goggles for adults. All right, so here's where I kind of overlap with our previous webinar. So I'm going to move through this a little bit quickly. Again, when we start noticing that there are issues with airway, when do you address it? Do you address it when you've got a little baby? Do you address it as you've got a kid, a teenager, when you're an adult, when you're in the middle of your life, or are you at the end of your life? And what are your options towards that end of the spectrum? Okay, here traditionally, since sleep apnea was defined, and we've now understood how many chronic conditions it can lead to, a CPAP device is often given to people. There is a new device called an Inspire, which basically it's like a little pacemaker, goes right in kind of your pec area here, and anytime you start snoring, it stimulates a hypoglossal nerve, which pulls your tongue forward to kind of create space here. Okay, and that is surgically implanted. And now we also have lasers, right? Got something called Babylase, Oralase, L.A.F.T.R, Comfortlase, high level light therapy. And we don't offer this in our practice yet, but we will soon, something called Nightlase, which addresses snoring by increasing collagen production in the soft palate. And when you're addressing all of these things, it's not something that's just the dentist, right? It's not just the dentist. We've got myofunctional therapists, we've got body workers, we've got orthodontists, we've got sleep medicine doctors, we've got EMTs. So a lot of times all these people are involved in trying to figure out how we address the needs of what's happening. So if you've got all these people helping, you're going to get better results if you start younger, and you can kind of get a healthier curve of growth, right? All right, and where did this all start? Currently, the theory is that this is not a genetic situation. This isn't because your mom and dad snore, you snore. This is because of changes in the culture, how we eat, what we eat, and where we live. Okay. This book, Jaws, is really great. Talks about a lot of it. More technical than this book, Breath by James Nestor. And one of the big takeaways from Breath is talking about properly breathing in and out through the nose and understanding that diaphragmatic breathing, using your diaphragm to breathe instead of your muscles here or even in your abdomen, requires proper mechanics. And in order to get that proper mechanics, you have to be in balance. And when you're in balance, you can maintain optimal tissue temperature. So you, as a closed body system, are trying to maintain optimal tissue temperature so that your tissues can work at the right speed, in the right manner, and for the best of you as your body. Okay, and we'll talk about that a little bit more, but there's a rhythm. There's rhythmic and continual movement of the diaphragm up and down in the core with proper inhalation and exhalation helps to regulate the core temperature and also is in line with your cerebral fluid and how that moves in your body. Okay. And what is an OMD? An OMD is having a dysfunction in some way, shape, or form, and it's not allowing you to have the optimal rhythm so that you can keep yourself in balance. Okay. And this came from the Breathe Institute. They compiled all these photos and you can see asymmetries, right? Lots of people have them. Some of them you'll recognize. You can see people doing compensations here. This is a mentalis strain here, having to purse lips in order to swallow, only using half your face. Why is that? Now, are these people handsome, beautiful, successful, happy? Yeah, but could their health be better? Maybe. I don't know them personally, but looking at this, probably. And what is the goal of therapy? The big picture of all this therapy and having that interdisciplinary team is to develop the optimal resting posture of the tongue, lips, and jaw so that you can facilitate proper nasal and diaphragmatic breathing. Okay, and if you can do that, you'll support growth and development of the face and the airway. And what Dr. Nordstrom has developed and why we use Oralase as a therapy is eventually personality. And here is getting into some of the surgical part of how we use that. Okay, and here we start talking a little bit about that cerebral spinal fluid, okay? And it mimics your breath in and out. So again, that rhythm of breathing in, inhaling, exhaling helps move the cerebral spinal fluid through your spinal cord and through your brain. And what that does is it helps to clean your brain. Okay. And if you're not breathing correctly and you're not doing that well, it's not functioning at optimal. And so what you get is that if the CSF removal is impaired or prevented from its normal cycle, you get a buildup of metabolic waste in the tissues, which can lead to inflammation. There's a lot of research coming out about some diseases that are related directly to protein buildup in the brain and what that means. Okay. And there's lots of research out there. If you're interested in that, you can look that up. Okay. But basically, because we know that the cerebral spinal fluid has to circulate through, we want to be able to support that as best as possible. Okay. And one of the, here is where Dr. Nordstrom says it's incumbent upon any practitioner to support this multifaceted process at the same time protecting it from events and interventions that displace or sidetrack it. So he has done a lot of research in how to do that with appliances, orthodontic appliances, with lasers, in order to support the natural rhythm of the body and to help the body get back online, okay? Proper swallowing, proper nasal breathing, and proper chewing serve as naturally rhythmically decompress the midface and the mandible. okay, which complements the reciprocal cranial motion because the bones in your head also kind of move with this rhythm, of the CSF peristalsis. Okay, at the cellular level, it also activates growth centers, refines the orientation of muscle fibers and their attachments. And this is where Dr. Nordstrom has done his research, facilitates the natural expression of individual growth potential in order to facilitate recovery from day-to-day traumas. And we'll get into that. When I figured out how to present this to patients in the little bit of time we have during an exam, I came up with 5 different things that these therapies do. And this 5th one is this kind of esoteric facilitating of individual growth. Okay. Here's how we do assessments for tissue restrictions and OMDs. And I'm going to skip through this. We went through this in the other webinar. And here's the fascia. We've got it tightening. You can see the sticky fascia down here, not allowing a lot of movement. Fascia are a network that's supposed to be tubules that are nice and lubricated so that as your muscles glide along each other, the fascia allows that movement. If there's trauma, whether it's physical or emotional trauma, neurobiology has started to show that the fascia tightens up. Okay? And if it tightens up, it restricts muscles, and that can lead to lots of different dysfunction. Again, here you can see this is kind of like a little net of fascia, kind of like what goes over the wine bottle. This person's moving a lot, getting that fascia nice and lubricated. This person, not so much, just tightening up, very sedentary, fascia doesn't move as much. And what we know about the fascia now is that it exists in the body in lines. So this is the frontal line. We've got going from the tip of the tongue all the way down the front of the body and into the toes, deep front line. We've got a lateral line here. And if there's a restriction up here, you can see how that's going to kind of pull and tug at other areas of the body, right? So that's where sometimes we have to, again, work as an interdisciplinary team to have those fascial restrictions addressed as well. These are just some links to what fascia looks like. And Denise actually brought this up to me. She saw somebody on TikTok, I think, who was talking about using oobleck. And if you've ever made it, or oobleck, my kids make it, like, I don't know, I feel like every summer camp and every time they do an experiment, they're making oobleck. And it's really cool because if you put pressure on the oobleck, it's a non-Newtonian fluid, it tightens up. Okay, it's kind of like when fascia tightens up. And if you release the amount of pressure you put on it, it's nice and gooey, kind of like slime. Okay, Emily's Wonder Lab has a great episode on that on Netflix. She's super cool. She calls herself the Space Gal. And now we're going to move into therapies. So again, here's our light walker. Here's our X pulse, and here are the wavelengths that we're going to use, the ND-YAG and the erbium-YAG. Okay, we've got the photobiomodulation we already talked about. We've got the high level laser energy because we can use it at a deeper level. We can get more profound effects. And we call it Babylase, Oralase, L.A.F.T.R, Smilelase. Those were all kind of developed, well, different people, but there's a legal case, something else is called Oralase. So there's a potential that it might be called Smilelase, but I'm kind of figuring all that out. Photobiomodulation, or what Photona calls comfort lace and night lace. Here's Dr. Nordstrom and Dr. Angie Tenholder, who's helping teach his principles. And what he says is that the normal integration and maturation of protective neonatal reflexes in combination with a healthy swallow and nasal breathing allows the individual to efficiently posture itself in space, which is proprioception, as well as gracefully move, sleep, and process daily events. So what we're looking for is for people to reach those individual milestones in an order. And if they're not reaching those milestones, if they're kind of getting there, here, there, what we're going to see are some retained reflexes. Okay, so when we're doing examinations of babies, of kids, of adults, we're looking to see if there's any retained reflexes. Here are what we look for in the oral assessment for infants as well. A lot of it having to do with nursing or sucking because that is where they are in life right now. With kids, we start talking about emotions. Is there anxiety? Are they nervous? Are they sad? With adult, definitely. And because with adults, they've been doing this for so long, they might not even recognize that some of what's happening could be related to these OMDs or tight fascia. Okay. And why are we worried about this? Dr. Nordstrom again talks about something called the anterior coupling response. And basically what it means is that the swallowing mechanism carries the highest concentration and diversity of cranial nerves, proprioception, and associated reflexes. So it's the greatest integrator of each level of function. So it perpetuates rhythmic motion, it helps to refine movement and function, and it helps with the global and interactive sense of self-development. Okay, it is a core player in the development of resiliency, individuality, self-regulation, independence, and your sense of self. So again, why is this important? Because we want to be physically and emotionally resilient. And that is a direct outgrowth of the natural development and refinement of the 3D postural stability and grace. Okay, so a healthy swallow will help in reigniting and perpetuating that rhythmic motion of breathing that coordinates the fascia, the visceral motion, and the brainstem in this recovery process. So this ACR protects the resources during the recovery. And if you don't have that ACR, if there's loss or attenuation of these movements, like there would be in sleep disordered breathing or in altered behavior patterns and affect, you might end up with a compromised immune. And Dr. Nordstrom also says reproductive systems. So this website, Solve Learning Disabilities, goes into a lot of detail about what primitive reflexes are, when they should have moved beyond them, and how some of the brain-based learning disorders, one of the things they found in common is the existence of primitive reflexes that have not disappeared by the age of 1. Here's a little timeline of when we expect those reflexes and kids to kind of move through those. And again, these milestones, if they hold on to them, things are not working in synchrony. So here's a quick one. Put your arms out like a star. Some of you may have already done this. Without thinking, on the count of 3, I'm going to ask you to cross your arms and your legs together. So 1, 2, 3, cross. Okay. Now look down at yourself without uncrossing. And if you've got same arm, same leg over, then you have moved past your Moro reflex. Okay, so here we've got this little girl with a retained Moro reflex. She's got one arm over, other leg crossing over. So right on top, she's gone past the Moro reflex, left on top, left on bottom. And this is when babies get startled by something, they automatically do this. So learning how to cross the midline is really important for babies, and learning how to do that is important for their development. When that doesn't happen, they could have a cascade of different consequences. Okay. The other thing that the Oralase addresses with the laser is understanding that the orofacial zone is central to the body's natural integrative processes. Okay, we've got cranial nerves, we've got vagus nerve, and by using these specific wavelengths, the intensity of the wavelength and the pulse shapes, we can have sequences of strokes predominantly in these areas that can create pleasurable and comfortable sensations to activate primitive responses. And what this does is open what's called a limbic window. And the limbic window is a primitive response that we don't have necessarily conscious control over. It is reacting to sensations. And if there are traumas and gaps that can perpetuate what's called limbic hypervigilance, those are the people that kind of are always up here, right? Can't kind of decompress, can't bring themselves down. All right. And that's a common component in chronic disease. So when we're looking at the nervous system, we've got, is the bear scary or is it a big teddy bear, right? We've got the vagus nerve, and lots of stuff going on with the vagus nerve, lots of research out there, lots of people talking about it. If you can upregulate the vagus nerve, you can calm yourself down, right? Lots of apps to teach you how to breathe and kind of get that all in order. And some people just can't. because they didn't develop in a way where their body can do that on their own. And so what the Oralase therapy is doing is kind of helping to integrate that. Okay, so a healthy ANS is able to shift from the parasympathetic to sympathetic fluidly. If you can't do that, you can get stuck, and maybe you get there eventually, and maybe you just don't, and you always stay in this really heightened anxiety. And staying in that heightened anxiety with inhibited saliva and dilated pupils and accelerated heartbeat and dilated bronchi and all of that over time takes its effect. It takes its toll, and that's where we start to see chronic medical problems later in life. Okay, so here we go. We've got Babylase, we've got L.A.F.T.R, we've got Oralase. Okay, we split it up in our office, just age dependent, just so that we know what we're talking about when we're talking to each other. They're different, but using the same principles. Okay, and then there's something called Hinsler, which helps with trigger points. Okay, and basically, again, liquefying the hyaluronic crystals that form in the fascia to tighten it up, providing the warmth to melt the fascia, get some more circulation in those muscles, strengthening neurological pathways, down-regulating the sympathetic nervous system, up-regulating the parasympathetic nervous system by addressing the vagal nerve, which kind of comes like down like this. And it opening up that limbic window for trauma release and emotional healing. And here's a little bit about the limbic system. I'm not going to go through this because we already discussed it, but if you want more information, there's some. And so here is Hinsler, and Luigi Stecco figured out of fascial manipulation that there are trigger points. So using the same handpiece that we use for the laser therapy, but now we're actually contacting tissue and using pressure at the same time, we're able to help release trigger points almost immediately. And that can help with healing, right? So we're using PBM, but we're also using compression. We're getting deeper into the muscle, and we're getting release like is not really available with any other kind of modality. Yeah, I think I said that all. And so proprioception, this is what the one thing that I got out of all of Dr. Nordstrom's teachings that a lot of people are not talking about, that proprioception or kinesthesia. It's the sense that lets us perceive where we are in space. If we can't do that, if we don't have that sixth sense, then it's going to be difficult for us to understand how to move, right? We're not going to be moving in that rhythmic motion across the many different systems in our body. And because that abnormal movement, it can precipitate due to strain, to fascial desensification, to laxity, to joint derangement. And when that happens, you offset the healthy posture and function, okay? And you concurrently trigger autonomic compensation and limbic filtering, or increased limbic activity, which is not what we want. So when we're doing the therapy, here's some of the do's prior to therapy. Okay. And it's kind of like you get ready for a spa day. Okay. But it doesn't take quite as long, and it lasts a lot longer, and the effects can be a lot deeper. And then we've got post laser therapy. And the biggest thing here is you don't want to just get up and kind of run out and start going back about your day. You kind of want to take time to just, feel it. You usually feel calm. You might want to play, take a nap, meditate, eat, snack, laugh, whatever makes you feel good. Okay. Common sensations of calm and connectedness, impulses to smile, seeing, dance, and snack, and immediate resolution of pain and increased range of motion. And that is something that we see a lot when we take our measurements prior to doing the therapy and then post-therapy. In dentistry, 1 millimeter is a long way, and we oftentimes see quite a few changes in millimeters depending on how tight things are in the body. If you're working with a body worker or myofunctional therapist, ideally you're doing this in concurrent with their treatment. And if you do it within the first 48 to 72 hours, you can see better results with the therapy that you're doing with them. This usually we say in the first 3 hours to 3 days is when you have the greatest effect. Okay. And you're encouraged to keep performing the oral motor and reflex integration exercises that you're already doing. And of course, to keep wearing any oral appliances you might have. This is a totally different topic, but I want to highlight Dr. Ludeman-Lazar and Dr. Levy. They are both pioneers in using the laser light. Dr. Levy is like the godfather of lasers, and Dr. Lazar is the one who, or Ludeman-Lazar is the one who developed L.A.F.T.R concurrently as Dr. Tenholder was doing this with Dr. Nordstrom as well. Okay, and then here we've got Nightlace, which we will be bringing into the practice probably in the summer to fall. And basically what we're doing, again, using the same lasers, but in different modalities, we're increasing the collagen. So you can see here how soft palate, not a whole lot of space for breathing, lots of snoring going on. After 3 treatments, and usually 6 weeks apart, you get more space, you get collagen production and a decrease in snoring, more airway space. Here you go, you can see airway volume before and after the Nightlace treatments. There are 2 steps. You precondition the tissue and then you do tissue strengthening. So it's using both the ND-YAG and the erbium-YAG according to the properties that we discussed in the scientific portion. And the reports are that if you do these 3 sessions over a 6-week period, I'm sorry, it's not every 6 weeks, it's over a 6-week period, the effects tend to last about a year. And all this leads to the fact that every person is individual, right? Different reflexes, different reasons. So it takes a team to figure out how best to come up with a treatment plan to address each person's need. And it doesn't mean that one is more important than the other, kind of like that 3-legged stool. It just means you got to figure out where you start. Do you have enough space for your tongue? Can you do the myofunctional therapy? Is your tether there? Do you need it released? Do you need more space? Do you need muscle work? Do you need body work? All of that stuff. Here we've got some reviews. I'm going to go ahead and read them. I'll read them quickly, but they are really touching. This one came from a mom who says, my 4.5-year-old son did 7 sessions of Oralase with Dr. Lopez over the course of 2 months in preparation for a tongue tie release surgery. 4 sessions led up to the surgery with another session immediately after and follow-up 2 weeks later. My son was super comfortable with Dr. Lopez as she thoroughly explained everything to him before she started, tested the laser on his hand to show him it wasn't painful, and also made it playful and fun for him. She put him at ease so that these sessions were not a dreaded event. She also put me at ease as a parent, having no idea what the treatment was about. He was very relaxed during these sessions, almost like he was at a spa, and always left the office in a pleasant and calm mood. He seemed to quite enjoy it. Measurements taken before and after each session showed a greater range of motion with his mouth and tongue each time. When it came time for his surgery, my son was ready both physically, being able to make and hold certain positions with his mouth and tongue, and emotionally, as he had to be awake for the procedure, but was absolutely compliant and showed no sign of fear. For context, a year ago, my son would barely get into a dental chair for a simple cleaning. And I am his pediatric dentist, so I can attest that that is true. He also healed from the surgery very quickly and without pain. We did Oralase as part of a multi-tiered approach to correct speech and oral posture. In conjunction with myofunctional therapy and the tongue tie release, my son can now pronounce sounds like L and S that he was unable to before. He used to be an open mouth breather in his sleep, and that has also improved. Although it's difficult to measure the tangible impact, I do firmly believe that Oralase has had a positive effect on my son's oral development. Another family here. Oralase has been a blessing to our family. It's an easy, relaxing session that immediately shows results in flexibility and is improving my son's movement and sleep the more procedures we have. In fact, my child's myofunctional therapist saw such great improvements in his mouth with only having done the laser and no other interventions. I'm so glad I've chosen this therapeutic path for many reasons. It's not only addressing my oldest child's immediate needs of relieving tension and stress in his facial muscles, but it's investing in his future by allowing his jaw and mouth to develop properly and avoid future sleep/breathing issues that many people develop later in life. Good deep sleep and nasal breathing is the pillar of health, and Oralase directly supports his healthy future. He has relieved tension and no longer complains of headaches. That I hadn't heard of before she gave our review, which is amazing because he was complaining of headaches quite frequently. My 4-year-old's sleep has definitely improved since beginning treatment. He's sleeping better through the night and has stopped his cute but unhealthy snoring. He looks forward to Oralase sessions. For myself, the Oralase has relieved my TMD and has helped me to relax my jaw fully. My jaw hasn't felt this great in years. It's also addressed painful trigger points in my shoulders. I've been sleeping very deeply as well. This mom also came in because she was having TMD issues, and so we offered to do it with her, and it looks like she also benefited. Lastly, this one really pulls at my heartstrings. This is an 18-year-old patient of ours, and just coming in for Oralase, no other therapies in his life. He had a very extensive medical history with a lot of stuff in the past, and he and mom have had a journey. And we did 3 sessions, and we canceled our last session because it was during the holidays. And when I got back from my vacation, I got this surprise email from her, and she said we could use it for the presentation. Since we last saw you, things have improved dramatically. M started working out, drinking protein, eating healthier, acting happier, engaging with family. He took a full-time job. He is working for a luxury cabinet shop, building and finishing cabinets. He is excited to learn. He's up at 6:15 a.m. He's lifting weights every day. He's looking forward to things again. I have no idea what role the light therapy and you played in this, but I felt like I needed to give you this update and tell you thank you so much. You've been such an amazing blessing to my family. I hope your holidays were lovely. Thank you for all that you do, and thank you for caring. And yeah, that one, when I read it, I think even still, it always just, I know him. He's my patient. He's been my patient. And all we want is the best, right? The best for our patients. So this is Dr. Nordstrom back when he was studying trigger points and acupuncture and hypnosis and all the different things that he did to kind of arrive at his philosophy and his principles. And this is what he says: humans begin life with an innate sense of self. The more we learn about nature, its normal patterns of development and individualization, how and why things actually intended to function, and how our patients adapt or cope in response to trauma, abnormal development, or faulty genetics, the more effective we can be in designing treatment to recruit and support nature and getting each patient on track to become their best self. And once I recognized that, there was no way that we weren't bringing this into the office, because how could we be responsible for seeing children twice a year, generally, from age 0, 1 to 18, be in the proper position, looking at the right functions, at the structures, and not bring this up? This is my friend Miguel, who passed away this month. I was up late last night working on this presentation because I chose to go back to Chicago for his memorial service this past weekend. And if there was ever anyone who was his most true self, it was Miguel. And I think I'm going to cry again. Get very emotional. But here's a picture that he posted to his Instagram of the Sears Tower, as all native Chicagoans will always call it forever and ever. And keep having a good day. Miguel is an inspiration for me to keep helping people live better lives. And thank you for tuning in. Hope you can join us next time. Here's our contact info if you need anything. Denise is also, let me look at this chat box.
The poll.
Oh, and Denise does have a poll here. Let me launch it. I forgot to do it this morning, but if you could just answer a couple questions, I'll look at this chat. Hi, Cecilia in Colorado. Yes, that Bond movie is really good. And Anna, who is my mom. Mom, what question do you have? Do you want to type it or unmute yourself so you can ask me?
I think she has to put it in the chat.
Okay, well, I'll call you Mom, okay? I'll call you on my way home. Thank you so much, everybody, for joining us. And again, we're going to have this recording. If you share it with your patients, share it with other providers. If you are a provider and you want to come in so that you can see how this therapy feels, we are definitely offering that, especially so that we can all form an interdisciplinary team. And I hope you guys have a great night. Thank you.